I'm all for freedom, but I think if you're dead, you don't have any freedoms at all. So it's probably important to stay alive before you start questioning your liberty. It's life, and then it's liberty, and then it's the pursuit of happiness. And those are in order of priority.
The superbly talented and very thoughtful singer-songwriter Jason Isbell has made it clear fans must show proof of vaccination or a negative test result to attend his shows. In his home state of Alabama, COVID hospitalizations are at their worst level since January, in the dead of our COVID winter. Just today, over 3,800 new infections were added to the list. Over 2,200 people are hospitalized with it. Just a month ago, that number was 267. Some essential surgeries have already been postponed to make room for COVID patients. For more, we welcome back to the broadcast Dr. Jeannie Marazzo. She's an infectious disease expert and professor of medicine at the University of Alabama, Birmingham. She's also the school's director of the Division of Infectious Diseases. Doc, thank you very much for staying up with us and coming back on. 2 weeks ago, in fact, on this broadcast, I was reminded tonight, you said the number of new hospitalizations was really concerning. Tell our audience, in just the space of 2 weeks, how your answer to that might change tonight.
Well, it's only gotten worse, as you showed with the graphs that you just displayed. Things are not just spiking, but we're seeing an almost vertical rise, not just in the number of cases, but more worrisome in the number of hospitalizations. And even more concerning, we know that hospitalizations follow the case peak, which then are succeeded by death. So our fear is that we are just beginning to see the beginning of a surge that could stress our system to the max, where we really are facing the kinds of problems that we heard Florida's facing today, where they're seeking ventilators from out of state. So very, very concerning trends here. Over 90% of our ICU beds in the state are being utilized right now, mostly by COVID. We are not a state that has a lot of medical facilities, right? We're not like Miami, we're not like Philadelphia, we're not like Boston. So when you hit a state like ours hard, you're really hitting people hard who are already very vulnerable to some of the worst effects of something like COVID.
You mentioned Florida is importing ventilators, even though the governor says he knows nothing about it. Texas is importing doctors from other states. Could you foresee a level of disease in Alabama where you're forced to do either or both of those things?
You know, I think anything can happen. I wish I had a good crystal ball and could reassure people, but the infectiousness of this surge is very different than anything we've seen before. The other thing that's different is that we're seeing more pediatric cases in the hospital than we've seen before, and that should really alarm people. The final thing I will say is that even if healthcare workers are vaccinated fully, and many of ours are, which is really good, they can still get infected with the Delta variant, right? These cases are less severe, they're less likely to be hospitalized, less likely to be really ill, but they still have to stay out of work. And so we're facing a potential decimation of our workforce just by virtue of this incredible wave of Delta. So that's going to really compromise our ability to provide not just COVID care, but care for all the usual stuff that our community really needs to be attended to.
And Doctor, just back up to the pediatric cases you mentioned, because I think there's a belief out there that, yes, kids are getting this Delta variant, but they're not getting really more than cold symptoms. They're not getting that sick. Tell folks the truth.
Well, the truth is that we are seeing a high of inpatient hospitalizations for pediatric cases. We have now 33 kids hospitalized in Alabama. We have never seen that before with COVID. It's really approaching a level that we might have seen with influenza in a very bad year. But this speaks to what I think is different about the Delta variant. We're still learning whether it causes more severe disease in general, but it seems to be acting differently in children. These kids are not getting the miscellaneous inflammatory or multi-system inflammatory condition that we saw with the previous strains of COVID, they're in the hospital getting intubated. About a third of them appear to be intubated or in the ICU. And when you're seeing kids under 2 years old getting a respiratory virus that is causing them to be intubated, that should really wake people up and think very hard about whether they should be wearing masks, whether they should get vaccinated. And I really, really can't emphasize enough, masks right now are the only way we're going to get out of this. If you get vaccinated tomorrow, you are not going to escape Delta, right? You need 2 doses of both of those mRNA vaccines, and you need some time to make antibodies. So right now, people really have to step up and mask up.